Okay, I think we're going to continue with our second panel, and our speakers will be focusing on some innovations, programmatic innovations from the field, so it's moving us to another area. I will again provide brief introductions. You have bios that have more details on all of our presenters. So I'd like to introduce Dr. Feven Teso. She's a medical doctor with more than 9 years of public health program management experience in Ethiopia. She's a trained physician and public health expert with expertise in HIV/AIDS related programs and initiatives at different levels. Dr. Teso is currently the Sexual and Reproductive Health Program Coordinator for CARE Ethiopia. She coordinates a large range of health-related interventions throughout Ethiopia, ensuring technical and operational excellence in compliance with the policies and regulations of multiple institutional donors. She focuses on programming related to complex social change and cultural sensitive areas such as gender-based violence, harmful traditional practices, including early marriage. She will be tag teaming her presentation with Jeff Ed Meads, who is a social demographer at the International Center for Research on Women, where he leads and supports design, implementation, and evaluation of projects related to reproductive health, adolescent transitions to adulthood, the determinants of contraceptive use, and the influence of changing population age patterns on development. He currently provides technical support to CARE Ethiopia on the Nike Foundation funded Towards Improved Economic and Sexual and Reproductive Health Outcomes for Adolescent Girls, or also known as TESFA project, which is taking place in the Amhara region in Ethiopia, and you will soon hear more about it. We also have Patrick Crump, who's currently serving as Save the Children's Associate Vice President for Program Quality and Impact, overseeing monitoring and evaluation and knowledge management as critical quality functions and integrating gender, youth, and other cross-cutting themes into Save the Children's programming. He has worked with Save the Children for 13 years, including leadership stints in the Republic of Georgia and in Egypt. And we also have Annabelle Arulkar, who is a social scientist with over 20 years experience developing and managing research and programs related to adolescence and gender issues in sub-Saharan Africa. Dr. Arulkar is currently country director of the Population Council's Ethiopia office. She has authored nearly 100 reports and journal articles related to adolescence in sub-Saharan Africa, including schooling, livelihoods, gender-based violence, early marriage, sexual behavior, reproductive health, and youth-friendly services. As an expatriate American-Canadian, she has lived in Africa for over 20 years, in Kenya, Ghana, and Ethiopia, and coordinated large adolescent projects in 10 African countries. Welcome.
Good afternoon, everyone, and thank you for the kind introduction. As was mentioned during the introduction, I'll be presenting on the TESFA project, which is the Towards Improved Economic and Sexual Reproductive Health Outcomes for Adolescent Girls, which is funded by the Nike Foundation and implemented by CARE in close collaboration with ICRW. Just a project background. The project was launched in 2010 and reaching more than 5,000 ever married girls, so including those currently married, divorced, and widowed girls between the age of 10 and 19. And this project was particularly to mitigate the effects of child marriage through a focus of two thematic areas: sexual reproductive health and economic empowerment. The project area, as you see, is being implemented in rural Amhara region of Ethiopia, where early marriage is actually very high, approximately half of the girls are being married by the age of 15, and almost all are getting married by age 18. Just the broader context for adolescent girls in the region includes low education rates. The issue around social isolation is really huge. Our project participants reported that 10% of them actually had no friends at all when they joined the project. There is a high rates of gender-based violence and female genital cutting. Again, more than 75% of the project participants had undergone female genital cutting themselves. And particularly, there is a limited access and utilization of health services, particularly reproductive health services, by project participants and in the area. So in this project, having a focus on married adolescent girls and mitigating the effects of marriage is, we think is very important, as their vulnerability is high, and also they fall through the cracks both from the programs and research eyes. So what was innovative about this program? So the first thing is working directly with married adolescent girls, which are very hard to reach and are most vulnerable from different perspectives. The other point is really engaging the community members in this effort to mitigate the effects of child marriage, creating the buy-in and support of community members through the approach that we call social analysis and action, and using the what we call the peer education model based on the village savings and loan approach that has been used in different settings, but really catering it for this particular groups, and mainly to create safe spaces for discussion and also training and education for the girls around the different thematic areas. So the participant-led girls group, there are different considerations made in these groups from the program point of view. When it comes to developing the curricula for the discussions for the girls groups, the curriculums are tailored to consider, of course, gender and contextual issues. And we have 3 intervention arms in this project, including sexual reproductive health alone, economic empowerment only, and also combined intervention. So when we, especially the combined intervention arm, is not simply putting the reproductive health and economic empowerment together, but really integrating the two in a way that can actually benefit the girls. And across the 3 intervention arms, we have the life skills training that really helps the girls to, have their negotiation and communication skills in terms of negotiating the use of services and other issues in the household and outside. Forming the girls group, again, this is where the community leadership and participation comes in, and it is the community leaders that actually identified and recruited the participant girls based on the basic minimum criteria that was set around age and marital status. And facilitation, as I was mentioning, is peer-led, and peer facilitators were selected by their own group members and were trained on the specific curricula and also the facilitation skills. The other component, which is the community engagement through the social analysis and action groups. Again here, at the formation stage, what was considered is to actually bring the social gatekeepers of adolescent girls, those who actually make the decision on behalf of the girl, be it for marriage or any other issues. So this group actually brings together various community groups, including religious leaders, health extension workers, mother-in-laws, husbands of the girls, and also parents of the girls. And the group actually have critical tasks or functions in this program, which includes they are key liaisons between the project and the community, at various stages of the project. They themselves actually go through a reflection and transformation process as a group, and particularly their engagement around supporting the girls groups as they go through the change and transformation process were part of their function as a group. I now transfer the discussion to my colleague Jeff to go through the evaluation and preliminary findings. Thank you.
Thanks, Vivian. I would like to just give you a quick overview of the evaluation goals and approach that were taken in this. And this is still very much a work in progress. The final baseline data were collected in April, and I received the email with the data last week. So don't expect very detailed evaluation findings at this point, but I can give some hints as to what you might see. So the core question that we were really interested in thinking through this, and which motivated the three-arm approach that Feven just described, was really trying to understand are there synergies, are there mutually reinforcing relationships between economic empowerment and sexual and reproductive health among adolescents? If you were to provide a combined approach, does it result in improved economic outcomes above those that you would see in the arm alone? Or the same for SRH? Are you seeing better outcomes? There are sound theoretical reasons for thinking that that might be the case. You have healthier girls may be able to save more or invest more, take more economic risks. On the other hand, wealthier girls may be able to access more reproductive health services. So really looking at trying to understand, does developing an integrated, carefully thought out program where you put the two pieces together result in better outcomes than each of them individually? And the motivation behind this is largely, as providers, we very often are stuck in thinking about, well, I do this very well. Doing something else is taking a risk. Adding sexual reproductive health training to my microfinance project is too much of a risk, and it may hinder my progress. So this is an attempt to address some of those questions in a more empirical way. We used a quasi-experimental approach where we divided all the girls into three arms, plus a smaller control group, and used purposeful matching of geographical areas to assign girls into these different arms. So it's a quasi-experimental, non-randomized selection in that sense. We did pre-post survey and qualitative work at the end to try to understand this process better for just over 3,000 girls, which are roughly divided between the three arms. The quantitative data is really complemented by this strong qualitative data, or data collection effort that really looked to try to understand the role of gatekeepers, working with SAA members, working with husbands, working with the girls themselves, working with their mothers, their sisters, trying to understand who is motivating change, how it's happening, and so forth. One of the really key and fun pieces of the qualitative work was the use of a really innovative tool, the photo voice, where girls were given cameras and allowed to go out into their community for a week and take pictures of the things that were important to them in their lives and what they felt had changed as a part of participation in the project. So we did that. You'll see one of the pictures from that slightly later in the presentation, actually right now. So this is a picture you see of a girl who is receiving her injectable. She went to the health clinic. She had her friend take her picture as she was doing it, and chose that as one of her pictures that she thought really was emblematic of the effects that she had felt as the TESFA project had gone forward. So again, very preliminary findings, not really trying to look across arms at this point, just really looking at some of the average change between baseline and end line. We really see increased correct knowledge of contraception in other SRH areas. For example, at baseline, 52% of the girls interviewed agreed that injectables and pills could cause infertility. By the end line, that was 10%. So some real shifts in correct knowledge. So knowledge transfer seems to be, preliminary findings, seems to be moving in the right direction, certainly. We see really sharp increases in actual use of contraception as well. So it's not just knowledge, there's something else going on there too. And other use of SRH services more broadly, antenatal care, and so forth. For example, there was a 16 percentage point increase between baseline and end line in the percentage saying that they had been tested for HIV, and just so much more confidence around being able to negotiate and seek SRH services, particularly when they're talking about negotiation with their husbands. And this speaks very much to this life skills component that Feven was discussing earlier. On the economic empowerment side, we see obviously sharp increases in saving activities, seeing as that was a core component of two of these arms. But there was also some real increases in diversity of economic activity. Girls are doing more things and earning more money in different ways. So this is a group-based often group-based, but often just taking loans and going off and doing their own thing. And we'd seen that almost a doubling in the percentage that had reported working for pay in the previous 6 months. So it's not just doing small-scale things, it's actually engaging in paid employment in a way that's slightly different than had been done before. And again, as with the contraception, we've seen some really sharp increases in this confidence in being able to deal with crises, being able to handle new events. In this case, we were asking them, if you had to, could you feed your family alone for 2 weeks? 67% of them by the end line said that participation in TESFA had made them more confident of being able to do so. And we had about the same percentage who were saying that they had really seen significant increases in their ability to negotiate with their husbands over earning money. We also saw a whole host of different changes that we hadn't really anticipated, but were very much hoping for. This is a mitigation program. It's really looking at trying to mitigate the effects of child marriage for married girls. What we saw was some real sharp increases in intent to return to school, significant increases in couple communication, very significant in this case, because we had 21% of the girls at baseline said that they never talked to their husband about their day-to-day lives at all. By the end, that had been cut in half. It's still 10%, still a very significant portion that we were seeing by the end line. Hopefully most of those are sitting in our comparison group. But there's some real shifts in understanding and relationship between couples. So we're seeing conflict resolution skills really playing out in ways that we hadn't totally anticipated. We're seeing some real changes in mental health measures, ideas of self-worth and self-confidence, and changed ideas of what women's role and their role as girls are in society. And this was coming from both their side and from the community. You could see one of these quotes from an SAA member as, "I observed huge difference in our life before and after TESFA. It was like the distance between the earth and the sky." And this is from an adult. This is not the girls themselves who are extremely enthusiastic about the project. Another one that we saw I thought was very illustrative of what was going on, and there's a relatively complex story behind this, but one of the girls said, I want the world to know that washing his feet used to be my responsibility. Men come in from the field, one of their wives' duties is to wash their feet. And now she says she doesn't have to do that anymore. She really wanted people to know that. It's an important thing. This was something that came up repeatedly. It wasn't a single event. So something is going on. There's some significant changes. It's not just from the girls either. And then more interesting, I think, proof of that is that documented cases. So these were the cases that were very much documented of 180 prevented marriages during the one and a half years or so of the intervention. And of course, this is a real undercount of what was going on. These are the ones who had progressed to the point where an SAA community member had actually gone and intervened and tried to prevent the marriage. What we don't know, of course, is all the marriages that may have never been arranged or had been postponed as a result of this process. So that's a preview of the evaluation findings that we're working on right now. We'll be completing that evaluation in September, October, so certainly keep your eyes peeled for that as it comes out. I'll turn it back to Feven now to talk about some of the lessons learned and next steps and recommendations.
So what have we learned as a result of implementing this project in the rural Amhara? The peer-led girls group, even in a rural and very conservative setting, as we were describing, is really effective, particularly to provide the critical safe space for the girls and also expanding their social network through that process. But also, this support group system is really a very effective platform for providing or for delivering different trainings based on the project design. The other thing is the engagement of community and, to reach and then to achieve buy-in, and also linking this community support systems with existing structures and not really creating other parallel structures, but using the existing community support system to inspire commitment for further social change, as we've seen, preventing early marriage and also supporting the girls to aspire and achieve different results as, like returning back to school. And the community reflection and transformation process is actually really generates the environment for girls to feel supported and also to actually be to negotiate different aspirations that they have. So targeting gatekeepers has really been a game changer in this process. The other thing is the rapid change that has been observed in knowledge and behavior, even in using this approach was really visible. And then the life skills training, which was being done across the 3 intervention arms, really improved the negotiation and communication skills of the girls, both in the household and with the community. And it actually helps to extend the outcomes, as you've seen, beyond the health and economic empowerment, which were the primary focus of TESFA program. So coordination between the design and evaluation from the very beginning has been a real lesson for this process. And program participants can actually make a big difference in the lives of the girls. So, I mean, we generally think that mitigating the effects of child marriage should actually be, the primary focus of more programming and can actually contribute to the prevention of child marriage. So as a recommendation, more focus on married girls is needed for different reasons, but particularly to give the girls voice and visibility in their community and in the society, and as well as in their own households. Working with communities through the social gatekeepers is a very important issue as well, and particularly to enable them to be change agents, to own this issue, to own the issue of child marriage, and also to be the transformers, or to actually be part of the solution as well. And fully integrating evaluation and program design has also been the lessons from this. So as a next step, communication and dissemination of the findings, the lessons that we have from this project, both at national forums and global forums, is the first thing. And the issue of going to scale. Again, this has been done in 2 districts of the rural area. But I mean, just looking at the huge need and demand, not only in Ethiopia, but elsewhere, this is a big issue to consider, and also to research how effectively to scale this up, especially this bottom-up, community-owned processes through the group-based approaches that we used for TESFA. And active engagement at national and global levels or forums to inform these lessons, and also to influence some of the decisions made at different levels. Thank you.
Thank you very much to Fevin and Jeff. And now Patrick, please.
Hello, I'm Patrick Crum from Save the Children, presenting on the Ishraq program, which was one of the programs reviewed in the ICRW survey that was mentioned in the earlier panel. This program has actually been going on for, 12 years, implemented by Save the Children with Population Council. Our main Egyptian partner is the National Council of Youth. We also had roles for SEDPA, Caritas, local youth centers, and local NGOs. My involvement, I was the country director in Egypt for sort of the middle period, 2004 to 2008. And at the time, we were really focusing on getting national involvement from the National Council of Youth. In other words, not just the youth centers at the village level, but getting the National Youth Council to own this program to some degree of success, not complete. First, something on the situation of girls in Egypt. Again, it was mentioned in the panel, the first panel. Egypt is a country with a fairly high level of early marriage. You can see here ranked 126 out of 132 countries on the Gender Gap Index. Did particularly poorly on disparities around labor force participation, income, education attainment, and political empowerment. High unemployment rates of girls, Quite a few of the marriages are actually to older men. A lot of female genital mutilation, that's still very prevalent despite years of campaigning against that. And where our program focuses, it's one of the hot spots we talked about earlier. Rural Upper Egypt, which is south of Cairo, is really where most of the early marriage phenomenon exists. So what I want to do is really give an illustration of a program. So our hypothesis is that if girls are given the chance to get back to school, they will be on a new life trajectory. And we have two main components. Again, it's very similar to the program in Ethiopia, an empowerment package for girls combined with intensive community engagement. The program, each girl goes through a program of about 18 months. It's fairly intensive, and you'll see our numbers are still quite low, but it is life-changing. The empowerment package consists of literacy, life skills, sports, all within a safe space, the youth club, as well as a process of fairly total community engagement. That equals, if a girl can pass the government literacy test, she can get back into middle school. She'll be a bit older than her peers, but once she's back in school, if she can stay in school, she's really got a different life trajectory. And here's one of our examples. This is from the very first wave of participants from, she started in 2001, Kulthum, named after the famous singer in Egypt. So she began the program at age 13. At the time, she was an illiterate girl who hardly went out. Many of these adolescent girls, as boys, their opportunities are opening as they enter adolescence. Girls, it's the opposite. The doors are closing, and they face, a life of domestic seclusion. She joined the program in 2001, again, about a 2-year period. She managed to pass the adult education exam that allowed her to go back to middle school. She also gained some life skills. She gained some sort of business sense, and she started a sweet shop to help her family with their income. So going to school and working in the afternoon. She managed, I asked one of our people in Egypt, what's happened to her? And they said, well, she actually graduated from high school at about the age 18 and got married at age 20 rather than age 15, as might have been the case. And she has 2 children. And the quote here, again, echoes some of the findings in Ethiopia. This is the way many of these girls talk about the impact of these kind of programs. I found a big difference in my life. I can deal with my children. I can manage money now. I can talk with my husband. I can discuss issues. So often they talk about learning how to speak with others, not argue or not shy away. So now I'll go back to describing a little bit more the two main components of the program, the empowerment package. You've heard several times now the term safe space. This happens in a physical location that has a wall around it, and boys are not allowed in for certain hours. We would do in a village usually 2 classes of about 25 girls each. They attend several times a week over 18 months. Another very important component, we don't have peer educators, but we have local facilitators. Those are educated girls, usually 18, 19 years old. They've graduated from the same village. They become role models for these out-of-school girls. And then we use Caritas's literacy curriculum in Egypt. It's actually one of the best, has been used for many years, but not combined with these other elements. We use SEDPA's New Horizons life skills program, again, tested during the late 90s, a very, very effective program. We've recently added our own sort of livelihoods curriculum, which we call ambitions or youth ambitions. So you've got the 18-month literacy program. We had other components that are shorter, but that sort of keep the girls engaged in these other things. And then sports. Again, during the week, 2 or 3 sessions of sports. These are team sports and calisthenics. The other main component is community engagement, and I would agree with our previous speakers. This is essential. You can't go into a village and try to mobilize the girls without addressing the community and the parents' concerns. And much of Ishraq is, in fact, a negotiated program. So we need to understand, why are parents taking their children out of school? Why are they taking their girls out of school? Often it was concerns about protection, concerns about marriageability. And if you can address those concerns, they were often willing to allow their girls to enter this program. We got religious leaders, Muslim sheikhs and Christian priests, to endorse the program in community meetings. We literally went house to house. Our facilitators would go house to house to find the girls, talk with them and their parents to try to encourage them to join. Over time, we brought boys in, so the boys would sort of wonder, why are they only focusing on the girls? We have now a boys component. I'll mention that in a bit. We also had to work quite closely with the Department of Education. Re-entering school is not quite as simple as it sounds. Yes, you need to pass the test, but then there's all sorts of other bureaucratic, you have to convince the headmaster of the school. The girls often needed extra tutoring because they hadn't studied English and a few other things that are not in the curriculum. Just briefly, these are sort of program results over many years. Again, our end line is quite old now. It's about 10 years old now. But it measured attitudes. 65% of the girls felt they were strong and able to face any situation, any problem. They felt they had more influence over marriage, timing, and partner selection. We also tested this program against a number of single component programs. Literacy alone programs are frankly miserable failures in Egypt. These combined programs are much more successful. Our cumulative program results, about 92%, these may be a bit old, but most of the participants are actually passing the literacy exam. Of those, maybe 2/3 are able to re-enter school. And here you can see our numbers over these many years. We've worked in about 25 villages and 5 different governorates of Egypt, and about 2,000 girls have completed the program. So very intensive, still fairly small program. Just a word on, this was from the end line in 2004. It's just a snapshot how girls felt about marriage. So if they'd never participated in the program, you can see it's something like 23% said they would accept a suitor if he came today, versus those who completed the whole program. This was back in the early years. Many girls didn't quite make it through the full program, but those who did, I think it was something like 73%, said they would not accept a suitor at that stage. And then there was a certain amount who acknowledged that the family actually made the ultimate decision. And since that's fairly old data, we also have very fresh data on the new component of engaging the boys, and I just wanted to share that. This is a program, the author is actually sitting in the audience with us, Brad Kerner, Choices. It's a program that involves both girls and boys, primarily trying to encourage boys to understand the gender attitudes that they are absorbing from their society, and getting them to sort of ask questions. What we found here, these are 11 sessions over about 22 hours, so it's a fairly short program, but this opened their eyes to their sisters' seclusion. So at the baseline, what would you do if your sister was not allowed out? 45% said they would do nothing. After only 11 sessions, that was down to 15%. And here's some options of what they might do. They might actually go out with her, or get her what she needs, talk to the family, etc. So this is a very promising component of enlisting boys as allies in their sisters and eventually their wives' cases. And finally, just to mention some lessons learned. Egypt's a country where we're moving towards full enrollment, and reaching girls earlier is actually a much better strategy. Early childhood care has become very popular in Egypt. It's not very prevalent, but if we could get girls at preschool stage, they would start out school much better and have a better chance of staying in school. Mentors are key role models. These are the girls who are slightly older, they're graduates. For the girls to see that in their own community there's a role that they can aspire to. It's realistic. That was important. It's not as simple as getting them back into school. They have not had English, they haven't had math, they're older than the other students, so that the peer group was important, and tutoring was also important. As I said, I think engaging boys shows quite a bit of promise. And the challenge that was mentioned earlier, we face in particular, we have struggled to find a way to really take this program to scale. The Ministry of Youth is a very weak ministry, under-resourced, and they're sort of there with us, but they don't have the resources or even the vision to really take this to a broader scale. And I think the ICRW study said we really need to look at these broad Ministry of Education type programs and build supports into those. That's really a way to go forward for scale. So thanks.
Thank you very much, Patrick and Annabelle. Please come up.
Okay, thank you very much. So I've entitled this presentation, Alternative Approaches to Delaying Marriage and Supporting Married Girls. And in this presentation, I'll be focusing on the evolution of our child marriage activities of the Population Council and our partners, also again focusing on Ethiopia. So just as some quick background on child marriage in Ethiopia, as you know, Ethiopia has one of the highest rates of child marriage in Africa, with over 40% of the girls in Ethiopia being married by their 18th birthday. What sets Ethiopia apart in East Africa, among other early marrying countries in East Africa, is that here in Ethiopia you have very high rates of the earliest child marriage during early adolescence or by the age of 15. So fully 14% of girls in Ethiopia, which is the second largest country in sub-Saharan Africa, or 1 in 7 of the girls in this country, are married during early adolescence or by the age of 15. And if you look at the characteristics of these earliest marriages, you see what the probable trauma that these early marrying girls goes through in their transition of these two early marriages. So, for example, among girls that marry before the age of 15, 71% met their husbands only on the day of the wedding. And among girls that were married before the age of 15, about a third of them, 32%, experienced forced sexual initiation within the context of these early marriages. And 61% of girls married before the age of 15 had not started menstruating by the time they had this a sexual initiation, often forced sex. And yet, as we've said earlier in these discussions, in sub-Saharan Africa, we have relatively limited and scattered programmatic efforts to delay marriage, and even more limited is our evaluation data. So I'll take you back about 10 years when the Population Council and our partners first started to work on child marriage in Ethiopia. In about 2004, the Council and our partners developed and tested a program called Birhani Hawan, which means light for Eve in Amharic. And the partners in this program are the Ethiopian Ministry of Youth and Sports, the Amhara Regional Bureau of Youth and Sports, and UNFPA, with support from the United Nations Foundation and Nike Foundation. And the objectives of that original pilot were both to delay the age of marriage among girls who were not yet married, but also to support girls who were already married. And the program was implemented in the Amhara region, similar to the CARE program. This is the second largest region in Ethiopia, with, as Dr. Feven said, the highest rate of child marriage in the country. The design of that initial Birhani Hawan program was based on formative research, both qualitative and quantitative, in rural Amhara that helped us to identify the drivers of early marriage. So in this table, I've sort of summarized some of the drivers that we found in rural Amhara, as well as our programmatic response. So, for example, to address the issue that communities value early marriage, we implemented community conversations, which is a very popular approach in Ethiopia, where communities get together to identify challenges and issues within their communities, and then also devise homegrown or community-driven solutions to address the practice. There are also economic incentives to marrying a girl early. So, for example, in these very remote rural areas, you have these very large, very poor households. And so marrying a girl off early it represents one less mouth to feed. So as part of this program, we offered a conditional cash transfer. In this case, it was in the form of a goat to offset the economic benefit of marrying girls off. So the way that this worked is girls and their families were offered a goat if they agreed to keep the girl unmarried and in school for the 2-year duration of the pilot. And at that time, the goat had a value of about $25 US. And we also knew from our survey research that out-of-school girls were particularly vulnerable to these early arranged marriages. So through this program, we provided girls with school materials, mainly school supplies, to address the economic barriers to schooling and to ensure that they remained in school and in that environment that's essentially protective against an early marriage. And we also, as Dr. Fevin mentioned, we also knew that girls were highly socially isolated, particularly girls married adolescent girls. So we mobilized these girls into girls' groups that were led by adult female mentors. And once they were in groups, we implemented a life skills curriculum that included topics such as communication and self-esteem, reproductive health, and family planning, among others. And also within these groups, girls who wanted family planning were given a voucher to subsidize the cost of the family planning if they wanted it. And importantly, they were also offered accompaniment to the clinic, because many of these girls have never been to a clinic before. The clinic may be very much at a distance, and just having the accompaniment of an older mentor was probably something that would give the girl confidence to go for family planning if she so wished. So Burhani Hewan included had a quasi-experimental research design with population-based surveys at baseline and endline in experimental and control areas. And what we found at endline, after 2 years of implementation of this scheme, that girls aged 10 to 14 in the Burhani Hewan site were 1/10 as likely to be married and 3 times more likely to be in school compared to girls in the control site. If you looked at married adolescent girls in the Burhani Hewan site were 3 times more likely to be using family planning. And so what these results really demonstrated to us is that it is possible, even with these relatively modest interventions at the community level, to make a significant impact on the age at marriage in a relatively short period of time. Remember, this was just a 2-year period of the intervention. However, at the same time, this was a package of interventions, and there was actually high levels of exposure to each of the elements of the intervention. So it was difficult for us as researchers to tease out what might have been most influential in the positive impact that we saw. So was it the school materials? Was it the community conversations? Was it the goat? We really couldn't tell which of these components had the most influence in these positive results that we saw. And at the same time, there were also lingering questions about the cost of these interventions, particularly whether or not these interventions could be scaled up in this resource-poor setting of Ethiopia. So based on these lessons, so this first generation of work on child marriage for ourselves and our partners in Ethiopia both generated lessons and also raised additional questions. And it's with those additional questions that we entered into our second generation of work on the issue of child marriage. And it's also at that point that we sort of separated the work off into 2 streams, so that we had one specific inquiry into what's the best way to delay child marriage in Ethiopia. And then we also had other programs that looked at what's the best way to support girls who were already married in the country. so with the support of USAID, we're now testing the relative impact of these individual strategies to delay the age of marriage in child marriage hotspots. And this project was mentioned earlier, of Ethiopia, Tanzania, and Burkina Faso. So what we're doing is in different districts of these three countries, we will be separately implementing these strategies: community education or awareness raising, support to keep a girl in school either by way of school supplies or school uniforms, a conditional cash transfer. We'll have a full model where all of these strategies are implemented just like in the first phase of Berhane Hawan. And then we also have a control area where none of the interventions are implemented. In order to evaluate the impact on the age at marriage, marriage dynamics, reproductive health, and family planning, we have baseline and endline surveys in experimental and control areas. And very importantly, we are also tracking the costs. So we'll be able to tell our partners, we'll be able to tell governments what are the costs of these interventions and what's the cost effectiveness of them as well. So, between the countries in this initiative, the interventions do vary slightly, but I'm just going to tell you a bit more about what we're doing in the Ethiopia intervention. Like I described before, one of the awareness-raising interventions is these community conversations, which is a popular approach in Ethiopia. It's a community discussion on problems they face and how to solve them. In other districts, we're also looking at capitalizing on the considerable reach and influence of the church in rural Ethiopia. This region is overwhelmingly Orthodox Christian, and they have incredible influence in these very remote rural communities. So we will be training, or we have trained, priests in those communities to convey messages on early marriage, and we've also asked them not to preside over these early marriages. In the promotion of schooling arm of the study, unmarried girls aged 12 to 17 are eligible to take part in this arm of the study. And what they do is they register for the project. So they come to a central area with their parents. They register for the project. They sign up and say that they would like to take part in this scheme. And the parent agrees to keep the girl in school and agrees to keep her unmarried, and allows project staff to review her attendance to ensure that she is, in fact, attending school. And then after that, the girl is supplied with school supplies twice in a year. And through a similar method, the conditional cash transfer is also eligible for unmarried girls aged 12 to 17. She comes to a central place. She registers for the program. The parents agree to keep her unmarried and in school for the duration. After 12 months, we've changed it from goats to chickens. After 12 months, she'll receive 2 chickens. After 24 months, she receives another 2 chickens after we've verified that she has remained in school and unmarried. So I'll show you a bit of the cost data. As I said, that we are tracking the costs of these different interventions prospectively as we implement the model. And so as you can see, the community awareness component is the least expensive, costing about $17 per girl per year, followed by the educational support, which is about $20 per girl per year, and the conditional cash transfer is about $39 per girl per year. And the other thing that's very important about these types of interventions is that we want to make sure that we make an impact at the level of the population. Our evaluation data is at the level of the population. So in that way, we don't want to just reach a few girls here and there. We have to reach a minimal threshold of eligible girls in those communities in order to make a difference and, detect a measurable change in the age at marriage. So we are tracking the coverage or the uptake of these different initiatives. And I've listed our uptake in the bottom of this slide. As you can see, the uptake of these different schemes is significant. Between 95% and 99% of the eligible girls in these different districts have signed up for their respective programs, which really does show that there is a high degree of acceptability of these schemes and a high degree of willingness to change norms when communities are given other opportunities. We're about midway through of this initiative, so we've done baseline and endline surveys in Ethiopia and Tanzania, and they have completed their first year of intervention. They have one more year of intervention to go, followed by endline surveys in 2014. The Burkina Faso arm of the study has recently been added, and we are now, the baseline survey for Burkina Faso is currently underway. And that, by the way, is a picture of a girl with her 2 chickens. After as I said earlier, when we moved into our second generation of work on child marriage, we separated the work into 2 streams. We looked specifically at initiatives to delay marriage and also initiatives to support girls who are already married. So I'm just going to, before I end, share with you very briefly our experience in our second generation of work supporting girls who were already married. So with support from USAID PEPFAR, we implemented a program called Meseret Hiwat, which started in 2008, and this was a partnership with the Population Council and the regional government in the Amhara region. And it supports married girls aged 10 to 24 in rural Amhara region. Through this program, we recruit mentors from these rural communities and train them. And after training, they go house to house to recruit married girls into girls' groups. And it's during that house-to-house visit that they can actually negotiate with potential gatekeepers. So they can negotiate with husbands or they can negotiate with in-laws for the girl's participation if there is resistance to her joining the program. And once in the program, they go through a curriculum that covers topics such as self-esteem, HIV/AIDS, STIs, VCT, reproductive health, menstruation management, family planning, and among others. When we started this program, shortly after that, husbands asked for their own program. So we designed a program called Addis Burhan, which is to mobilize husbands groups in the same locations where we implemented the married girls groups. And so this program uses a very similar mentorship model. It uses male mentors recruited from the community who go house to house and mobilize these groups of husbands. However, for the curriculum of the husbands program, we designed it to forge a more supportive environment for married girls within those marital relationships. So the content for the husbands curriculum focuses on partner communications, nonviolent and respectful relationships, caring for wives and children, alcohol, HIV, VCT, family planning, among others. I will show you some of the program data we have associated with this program, which is indicative or suggestive of some positive improvements associated with these programs. So these 2 graphs are based on post-intervention population-based data, and I've graphed 2 outcomes. In the left-hand graph, it's the percent of girls who are reporting their spouse having accompanied them to a clinic in the last year. And in the right-hand graph, it's the percent of girls reporting that they have undergone couples VCT with their partner. And it's graphed according to participation. So the left-hand bar is no participation within that household. The middle bar is where only the married girls participated. And the right-hand bar is where both members of the couple participated. And as you can see, with increased participation, you have increased improvement in these outcomes. So for example, if you look at VCT, it goes from, if there was no participation in the household, it goes from 11% reporting having had VCT. And when both couples participate, it goes up to 65% reporting that they've had VCT. Now I want to emphasize these results are not airtight. They are suggestive of a positive impact, but through this type of analysis, we couldn't control for selectivity biases or biases that are created when people joining programs versus people not joining programs have different characteristics. So it's not airtight, but it is suggestive of a positive result. I would also like to say of Meseret Hiwat, the married girls group, when we started this, a lot of people in the country said, you'll never be able to access married adolescent girls. Husbands won't let them out. Their in-laws won't let them out. They're very much protected, and they're doing a lot of domestic work in that household. I think that the scale of this particular program proved them wrong, because up until recently, we reached, since 2008, over 220,000 married adolescent girls through this program. It is our most highly scaled program, again proving that there is potential to do these programs at scale. Just to sum up, and just to give some final thoughts. So I think that our interventions addressing child marriage are demonstrating acceptability in the communities and also suggesting some positive results, particularly within a relatively short period of time and with a relatively modest investment. Similar to, I'd like to underscore some of what Jennifer mentioned earlier, is that I believe we need to really focus attention in these child marriage hotspots, particularly in places where large proportions of girls are married during early adolescence or by the age of 15. I also believe that these resources need to hit the ground, and they need to be directed towards the girls themselves. And finally, I think that, a lot of us practitioners often assume that family planning, that married adolescent girls are not a good candidate for family planning. Some of our data in Ethiopia is showing that, in fact, there is a demand for family planning. A lot of girls, even girls who have not had children yet, are interested in having family planning, and I think it would be a missed opportunity if we don't explore some of these potentials for adolescent girls, married adolescent girls. Thank you very much.
Thank you, Annabelle, and thank you to the 4 presenters. I think we heard really terrific technical presentations on ongoing work or work that's come from the field recently. And before we go to the question and answer session, to help us make sense of what we've heard and pull the information together and maybe help us hone in on the exact questions that we want to ask our speakers, we are very, very lucky. And I'll move over here. We are very fortunate to have Margaret Green be able to come and give some closing remarks for us. Margaret Green has worked for nearly 20 years on the social and cultural determinants of sexual and reproductive health, development, policy, and gender. She's widely known for her research and advocacy on the conditions faced by girls and women in poor countries, and on engaging men and boys for gender equality. She's worked extensively in recent years to call global attention to child marriage and to highlight its linkages with education, health, human rights, and other dimensions of girls' well-being, as well as to highlight how programs and policies can work to end the practice. She currently directs Greenworks, a consulting group working to promote social change for health and development. Meg, please come up. Thank you.
Thank you. And good afternoon, everybody. I've enormously enjoyed today's event, and I feel that it has delivered on its promises to share a vision, action. We've heard about policy and research and programs, so I have hugely enjoyed the afternoon. And really, after so many good presentations, what I'm doing right now is largely playing a ceremonial role in which I will kind of highlight, I think, some of the wonderful ideas and key themes that have come out of both sets of presentations and also some things that I've been thinking about in working on child marriage more broadly, because as you know, there's just been so much going on in this area recently, many different reports and events and global decisions and so on. So I wanted to touch on 4 key themes at this auspicious moment, which is auspicious because in light of the recommendation from the high-level panel to include a measure on child marriage in the post-2015 development framework, which is very exciting. First, I wanted to mention a couple things about what I see as the evolution in the field. What an increase in attention to child marriage over recent years, and a surge in events and research and programs in this area. And when I look at all that's going on, I ask myself, with each one, what are the separate contributions that each makes? There's been additional documentation of prevalence and numbers of child brides. The connections increasingly being made across issues and across sectors, that is to say, not only as a sexual and reproductive health issue, but with the connections between child marriage and education, economic roles, women's rights. And I liked Carla Capel's use of the term integration, which is, to say that child marriage is present in so many other issues, and it needs to be addressed across all of them. We've seen a shift in the nature of the attention, as Anju mentioned, the shift from a focus on legislation to more programmatic responses and very diverse. And that shift is still underway. Still, legislation is getting a lot of attention in a number of places where that focus on the legality is sometimes driving the practice underground. And so that's something important for us to keep in mind. But as part of all this, there's consensus on the need to change social norms and to convey the benefits of delaying marriage rather than to hammer away at the harms of marrying children and marrying girls as children. So to develop more positive messaging around this area. A second important theme, I think, is some shifts in how we are talking about child marriage. We heard, again, it sort of comes up in the decision on where to focus our efforts on child marriage. Should we focus on prevalence or should we focus on the numbers? Should we focus on the institutional presence, the government willingness, the existence of programs that are working in this area? And of course, all of these considerations are very important and come together in that decision to zero in on particular places in which to focus our programs. Certainly there's agreement on the need to focus on specific hotspots, which are often being identified at the subnational level. I think it's also another shift that's very exciting is to the formulation of child marriage, not only as a problem for girls, but as a development challenge. As people grow to understand the problem of child marriage in a more holistic way, the number of ways that different groups can address the issue is growing. And we see that across the programs, the connections that they're making with different sectors, and the opportunity even recently with the Council on Foreign Relations report to make the connection with foreign policy as well as the whole other range of issues. I do think that news coverage continues to focus on the problem of child marriage rather than being more informed on interesting solutions that are emerging, but I think we're all working on that one. A third theme I wanted to highlight was greater consensus on measuring success of these programs. Certainly there's greater agreement on the conscious need to focus on girls, and that's because child marriage is a challenging issue to work on, and so it is an accomplishment to have stakeholders starting to change their minds, or for those around girls and to begin to shift their position on the issue of child marriage. But really, there's also a very strong sense, and I think you probably heard it in a number of the presentations today, that that it's very important to measure the impact on girls themselves of these programs. One thing I liked very much about what we heard about the Ishraq project in Egypt was the specific steps that boys said they would take to support their sisters, like taking them places, accompanying them, getting them things. And this, of course, is a kind of change that mediates between attitudinal change and then the impact on the lives of girls. Another great finding that's relevant to this is what we learned from CARE and ICRW's work in Ethiopia, that the peer-led girl support groups work even in rural conservative contexts. So even where girls have little power and say, working directly with them and connecting them with each other seems to make a difference. And I think that's very exciting. The fourth topic I wanted to touch on was just a few lingering challenges, or big lingering challenges that remain for the field. The first is the need for evidence across a wider range of programs, and we've heard we've heard about some wonderful programs today, and a lot of them are generating some of the kinds of learnings that we need to develop better and stronger programs going forth, and to expand on those programs. In particular, I really wanted to highlight the need to pay more attention to economic alternatives for girls, because preventing child marriage is not like preventing a disease. You are changing the course of the person's life. And so there has to be something there. It's not just we prevent somebody from marrying at age 14 and then she's going to be hanging around and waiting until the appropriate age to marry. What is in that gap? What is there? So I think we really, really need to know more about the attention to the economic alternatives for girls. And the real reason I'm highlighting economic is that, of course, education is enormously important, but part of what drives an interest in investing in education is the sense that in the longer term, education is going to feed into economic roles in future. The need to work at greater scale, and I was very excited to hear that the work of the Population Council and its partners has reached over 220,000 girls in Ethiopia. That Berhane Hewan model is also being scaled up, adapted and scaled up with DFID and Nike Foundation support in Amhara region, and is being implemented very much through the government, and similarly has the potential for reaching hundreds of thousands of girls. I wanted to close with a last kind of mulling over something I've been thinking about a lot lately, and I'm grateful to all of the presenters for having shared their presentations ahead of time, and of course I wrote up my notes, but then while they were talking, a lot of ideas came to me, and I was scribbling illegibly on my paper, and then my pen ran out of ink, so I'm going to try to be articulate here. First of all, I wanted to say something about the language that we're using around child marriage. The term child marriage, was, I think that maybe Jennifer Redner mentioned that it's a term that the field began to use strategically some years ago to wake people up about very early marriage. But there are a number of other terms that I think have also certainly been waking me up and expanding my thinking about this. One is USAID's term, the needs of married children, to refer to married children. That is, I have been finding it that's a very powerful concept. Then also, there are two other reports that have emerged recently. One by, I think, End Slavery Now, which is on slavery and forced marriage. And then the report by the United Nations Special Rapporteur on servile marriage as a form of slavery. And what all of these have really got me thinking about is the problematic nature of marriage as an institution in many places, and the problematic nature of sexual relationships. And I think this touches back on the mention earlier about universality, because although I do think that child marriage is a sort of a special circumstance, it does reflect a broader set of relationships, and very problematic relationships, sexual relationships, in which girls often find themselves all around the world. And so just, there's a reason that that early feminists kind of zeroed in on the institution of marriage as a place where people spend a huge fraction of their lives, and which, if we cannot question some dimensions of it in some way, we have really fallen short in thinking through rights and quality of life and so on. So in thinking about all of these issues, this new and emerging and evolving terminology, the issue of universality, and the institution of marriage, this all points me toward the need to be talking about the social construction of sexuality. I think very often we're talking about preventing child marriage and mitigating some of what is happening within marriage. But in my opinion, we need an additional focus on sex. And that's because gender relationships very often, kind of more broadly, the ways that males and females interact with each other across different societies often have at their core some understanding or set of assumptions about the sexual relationships between males and females. And I feel that if we could get to that, we would really be moving this issue forward, and we'd be able to make much more progress. So please solve that in the question and answer discussion.
See, I knew it was going to be valuable for us to wait and hear Meg's closing remarks. I've just received a note that perhaps we should skip the Q&A and go directly to the reception. Are we seeing a yay or a nay? I'll tell you what, I'm going to use my prerogative of sitting up here. I'm going to veto that decision and take 5 minutes. Let's just take 3 questions, and so at least it gets us going for the reception. Does someone have the mic? We have one speaker here, questioner, I should say.
Thank you very much. This has been really wonderful, including the past panel. And I was just wondering why we are afraid to call child marriage rape violence. We kind of call it child marriage, and marriage is sanctioned by society. It's acceptable. You get a license, and you get a license to rape a child. And why don't we call it what it is? And I think if we were to call it what it is, then, there won't be this going in circles trying to protect a culture that is violent, in my opinion. And the second question is, the issue of religious leaders and how they operate with impunity. And why don't we bring them to account, especially when they sanction rape of children around the world?
One more hand up there. Mm-hmm.
Hi, thank you again. A wonderful afternoon, really exciting information. Question for Dr. Annabelle. By the way, my name is Marjorie Macieda, independent consultant, like Meg. About the conversations you had at the community about values, I was curious if you could just tease that out a little more, and if there are any issues there. When you first started, what were some of the things that maybe you had to deal with?
And then the gentleman over here. Thanks. I did.
Hi, my name's Adam Silo. I'm from the international development consulting firm Social Impact. First of all, thank you very much for presenting and all the great work you do in trying to end child marriage. My first question deals with issues within your specific programs of multicollinearity. And I was really heartened by, I have to apologize, I don't remember the specific names of your projects, so I'll refer to them by the country. By the second Ethiopia project, how in the lessons learned you realized you weren't able to directly connect the specific program with the result, and how you disaggregated that in the second phase. I thought that was great. And so my question is, for the first Ethiopia project, you mentioned how you implemented in all of the groups a life skills program, and so I'm wondering, did you have a group that didn't have life skills? And if so, how were you able to tell that maybe it wasn't the life skills program that had a major effect versus the economic or the sexual reproductive health? And then in the Egypt project as well, how did you decide to create an empowerment program that pulled together all these different aspects? Was that off a previous study that found working together worked really well? And if so, did you do any study to address whether or not separately they would have a different impact? And then my second question.
Hold on. Thank you. All right. Let's answer these questions, please. And I don't know how we want to, if is there someone in particular who wants to answer? I don't think we need to have everybody answer all the questions, so please.
I think that your question about why we're afraid to call child marriage rape is directly connected to what I was saying about the social construction of sexuality, because it's invisible as rape as long as it's socially sanctioned and, has holy water sprinkled on it and there's a signature in a book, so I think that your question is at the core, and I don't have an answer for you.
Does anyone else have an answer or an opinion on the question?
Well, I can answer the specific question about Egypt, why these components. Actually, that happened based on the conversations with the community. They actually requested these things, and they said this is what would attract them to send their daughters to these programs. And on the question, why don't we call it rape? I understand the human rights aspect of this. That's why we're all doing this. But I also have to say, I worked close to the communities, and what allowed us to address these issues was that we were able to dialogue, show that we understood some of the concerns that some of the parents had about their daughters. So I don't think that's an excuse for those things to continue, but the need to be able to work with the different actors is a concern if you're working at the grassroots level.
Just to comment on the religious leaders issue, we work with religious leaders as change agents, but as the community discussion goes on, the community themselves actually started to question the religious leaders themselves, not only to account for this, for blessing early marriage or something, but they were actually the ones who are married or marrying younger girls. And there is this community norm that the younger the girl, the better she is for the priest. So, that kind of reflection and transformation process through the community actually brings that out, which is good because it actually creates this kind of mutual accountability among the community themselves when they are being, involved in program participation. And I think Dr. Annabelle can also add to that. Maybe one question specific to our program around the life skills. Again, Jeff can add to that. Yes, we used to have the life skills only for the sexual reproductive health intervention and the combined intervention arms, but not for the savings and loan or the economic empowerment arm. And there was a significant difference among the girls, especially, in terms of their negotiation skills, communication skills, and being able to actually engage with income generating activity, which is part of the economic empowerment piece. And we've actually discussed and decided, this is actually creating a big difference among the different intervention arms. Even kind of creating bias, with the outcomes because we really wanted to taste the actual thematic intervention. So we've decided to actually make that across the arms. So.
And I would just say that keeping in mind what our evaluation question was, which was really what what if you packaged these two pieces together? We wanted to keep other things as constant across the programs as possible. So it was a deliberate decision to do that. I think the life skills component as well, it's worth thinking of when when you were thinking of the intervention for SRH, it's much more around communication around SRH matters. It wasn't very much a life skills intended initially as a broad life skills thing that would touch on economic matters as well. Whereas in the economic arm, it was much more how do you negotiate about work and so forth. And what I think we're beginning to find is that it doesn't really matter. What matters is that these girls have a framework for actually talking to their families and talking to their husbands. And that allows them to then talk about a whole other range of things. And what we were hearing in visits to the field is much more, we had no idea how to talk to our husbands about this. We just didn't talk. So if they had fights with their they would run back to their own family and stay there. And that was the way that they resolved conflict, because they had no way of beginning a conversation or resolving issues that way. So that is, I think, one of the not necessarily unexpected findings, and we know that life skills can be very powerful, but it's been very interesting seeing how training in a life skills with it theoretically in a specific area has just this very broad effect across other areas.
Annabelle, did you want to?
Yeah, I'll just I'll describe a little bit more the community conversations that we're using in our programs. This was a methodology, and I think Dr. Fevin will also know about the methodology. I think it was developed in the context of FGM programs initially, and then it was upscaled significantly in Ethiopia as an HIV intervention. One of the things that one of the challenges, though, that it was upscaled for HIV interventions with having only anecdotal evidence that it was effective. And so one of the important things about this study is really to be able to demonstrate whether or not this is a methodology that is effective, at least for the early marriage issue. So the way that it works is that their guideline is you're supposed to take about 70 people from the community. It's from a cross-section of people, young, old, men, women. It's just a cross-section from the community, and they get together within these conversations. They start by identifying problems or challenges within their community, and then they'll start to devise solutions and maybe break themselves off into smaller subcommittees who will deal with certain aspects of seeking a solution. So, for example, you might have a subcommittee that will say, okay, we're going to make sure that everyone in this community will not attend that child marriage. And so we're going to go house to house and tell everyone that we all agree that we're not going to go and attend a child marriage or some other thing. You know, another subcommittee may have a educational campaign with the priests in that community. So it's a really community-driven approach to dealing with problems. And another reason why it may be very effective in Ethiopia is because there's a lot of social cohesion in these communities. So it may be a very effective approach. And I think one of the contributions of the study will be to really demonstrate whether or not this approach works.
Thank you. I think I'm going to bring this wonderful event to a close, and I want to thank all the speakers again for really bringing tremendous presentations to share with us. Also want to share a few my thanks to a few people who've really done a lot of work behind the scenes to make this event possible. I want to thank Charlotte Feldman-Jacobs, Doris Bartel, Joan Kraft, Lee Stefanik, Lisa Aronson, Milka Kihuna, and the wonderful staff at the Woodrow Wilson Center. Thank you again, and I hope you can join us for the reception. Thanks.
Great, that was really interesting.
It was amazing how many similarities there were in these programs. Like it's kind of
see each other. There's so much overlap.
Oh my goodness.
We could have coordinated our